As it's well known, our approach in the health system of Ethiopia is primary care system, and that is a foundation for our healthcare system at all level. And we are aiming to achieve primary universal health coverage through primary care system. And the approach in Ethiopia is through health extension program. So that is the approach in Ethiopia that we designed to have really a good primary care system in Ethiopia. So in health extension program, we have trained more than 42,000 health extension workers, and most of them, more than 90%, they are females, and they are payroll based, and the government is paying their salary, and they are based in the special districts and the village they were born. So they know the health system very well, the community very well. So that is an important achievement in the health system. And the other important issue is to progress in terms of having robust and many primary care units. And before 20 years, we have just only 800 health centers. But now we have more than 4,000 primary healthcare system. And when we say primary care system, the units in Ethiopia, it includes health centers, satellite health posts, and of course, primary hospital where it is available. So we have progressed a lot in terms of having many infrastructures, and the government partners have invested hugely in this area. The other important issue is the community engagement. So we dwell in engaging communities. It's not participation for us, it's engagement. And actually we are aiming to empower our community in primary care system. So the community, especially model women in a certain village, will be recruited, and they are volunteer based, and they work with health extension workers. So there is a community network which is called Health Development Army, which actually focuses on women and young girls. So that's an important platform where our community interacts with health extension workers and with facilities at different levels. The other achievement is health financing. There is no any primary care without adequate health financing. And for this one, Ethiopia has rolled out community-based health insurance system over the last 10 years. And now more than 12 million households are benefiting from this scheme. And actually more than 60 million Ethiopians are in general benefiting from this important scheme. And the government share is also improving from time to time. And for example, last year, achievement in terms of financing is the government has contributed more than 13% of annual budget for health sector. But actually in terms of achieving Abuja declaration, we have to go so far. We are at 6%, but the government is investing every year. When you will see the service package in primary care system of Ethiopia, we have health extension package, and that package have more than 20 programs, and most of them focuses on maternal and child health. And when you see the achievement in terms of maternal and child health care, based on the recent study by United Nations and other UN organizations, the maternal mortality has been reduced to 267 out of 100,000. Before 15 years, it was more than 1,000. So there's a big achievement. And also for under 5 mortality and neonatal mortality, there is a big decline, so we need to go far. The other important service area in primary care system in Ethiopia is prevention and control of TB, malaria, and HIV. For HIV, for example, before 15 years, the rate of HIV in terms of incidence is more than 2.5%. But now it is less than 1%. So Ethiopia is working on epidemic control in HIV. And for TB, the incidence and the mortality have declined, and we are progressing very well. And even for malaria, we are working on malaria elimination in general. So we are building a very robust PHC in Ethiopia with excellent community engagement and empowerment, with excellent partnerships that we had with our partners and also through government commitments. WHO has been an instrumental institution that have been supporting the health system of Ethiopia for many years, and they are so much committed. And I mean, one of the best experience that we had with WHO is the collaborative activities that we have at national level and of course at sub-national level. For example, at regional level, they have offices and they know the health system very well. So the communication at national and sub-national level is an excellent platform to share information and to speed up the support. The other important issue is emergency response. the WHO staff at national level and at regional level reach to the scene, to the emergency areas almost with the ministry and with the national regional counterparts immediately. So they know the surveillance system we have. They have been supporting us. They know the difficulties in terms of emergency accessibility. So they were very instrumental on this matter, specifically in conflict-affected areas, in pastoralist areas, and in hard-to-reach areas. WHO has supported in many areas on this part of the issue. For example, in availing medicines, in capacitating our human resource at different level. Especially in timely response and surveillance issue, especially in emergency. And the other very important issue is capacitating our health professionals in different areas, in emergency areas, in other communicable and non-communicable disease areas. We have been working on strategy formulations, policy formulations, action plans with the support of WHO. And actually, WHO has been bringing many partners to Ethiopia. They have been supporting technically and financially, and they have been also sharing experience of different countries. And they also took our staff to different countries to see what other countries have achieved. And they have been also promoting the experience of Ethiopia globally. So we are so much happy for that one. And the collaboration that we have with WHO was time tested, and it was very robust. And it is bilateral type of communication, and we are working together. It's an excellent platform.